This little video series is Dying Dar's Way. I am here today with my nurse case manager, right, from Samaritan Healthcare and Hospice. And we are now responding to write-ins that have come from our viewers, over 2,000 so far. I will have you know, thank you for watching. And we actually had a request from an urgent care physician to describe the difference between palliative care and hospice care. So take it away, Courtney.
Okay, so something I read that was interesting is that all hospice care is under the umbrella of palliative care, but not all palliative care is hospice care.
Okay.
So lots of times we'll see maybe a patient in the hospital setting and a physician makes a referral for palliative care. And it sometimes is up to the hospice or palliative care physician. Lots of times a provider will do both, which is in the case of our Samaritan doctors. And they will kind of determine if the patient is more hospice appropriate versus palliative care appropriate. And the difference is.
Yes.
The difference is, so palliative care, you can still be undergoing, still have a serious illness, but you would be undergoing curative therapies. Whether you're a dialysis patient, you have kidney failure and you're on dialysis, that's considered curative. If you're a cancer patient still undergoing chemo or radiation treatment, that's considered curative. But you would still be eligible for additional care, such as palliative care. And what that is additional support in addition to your regular oncology doctor doing your chemotherapies. A palliative care physician and team, which is nurse, social worker, chaplain, spiritual support.
They sent me an art therapist.
And an art therapist would kind of symptom manage, whether it's pain or nausea or anxiety. We would help symptom manage, but you would still be eligible to undergo curative therapies and hospice care.
Okay.
Does that make sense?
Yeah, and I started out with palliative.
Okay, yes.
A lot of us start out with palliative.
A lot do. So sometimes your curative treatments can take a toll on the body, and perhaps they're not doing very much for curative purposes. They're not taking care of the illness. Sometimes they can make us even a little sicker. So in that case, and if you do not want to continue with these curative therapies, you could undergo hospice care. Hospice care can be provided in a number of different settings. It can be done inpatient if you're very ill and cannot return home. You're needing high level of care from nurse and doctors. You could go inpatient. We do hospice care in nursing homes and hospice care in the home setting. Right here.
That's where I want to be.
Yes, right here in your own home, in the comfort and support of your family. We come and visit. You can have a home health aide, you can have a nurse visit, social worker, chaplain, you name it. We send them all here to the home.
And I think I'm going to have just about all of it.
Yes.
Is that good?
Very good.
Thank you.
Thank you.